Hi, everyone, and welcome to The Breakouts, a podcast where we interview extraordinary founders in just under 20 minutes. I'm your host, Akkshay Khoslaa. Now, you'll find many podcasts out there that are 2 to 3 hours long and interview these wildly successful founders after they've already made it big. But by that point, the founders are already 5, 10, or even 15 years into their journey, so their insights just aren't as actionable anymore. We're doing things a little bit different. We're interviewing founders that are on the cusp of breaking out so that you can learn the playbooks they're using to build category-defining companies today. And we're doing it in just under 20 minutes. Now, just before we get started, go ahead and follow us on Twitter at The Breakouts Pod, subscribe to this YouTube channel, and join our Discord community for aspiring founders. The link is in the description below. A real quick disclaimer right before we get started. This episode is one of the first few we recorded, so the audio and video quality isn't that great. We're working to improve it so that we can deliver a better podcast experience for you guys. But regardless, the insights in this episode and the entrepreneur that we interviewed are amazing, so definitely still go ahead and give it a listen. And I think that's everything I have for you. So without further ado, here's today's guest. All right, ladies and gentlemen, welcome back to another episode of The Breakouts. Today we have with us, once again, Nick Aubin, the co-founder and CEO of Commons Clinic. Now, Nick recently raised an $11 million seed round, split into two parts, for his company, Commons Clinic. They're building something really cool in the health tech space. And if you didn't get a chance to listen to the first episode, go ahead and check it out. In the first episode, Nick talked about the story behind his startup and how it works. And I think he shared a lot of great insights that if you're looking to build in health tech, you could really benefit from. Now, in this episode, we're going to talk about strategies, tactics, and hacks that Nick has used to build his business. And the way we're going to carve it up is into 4 main sections. We're going to first start off by talking about product and how you think about making product decisions, Nick. We're then going to move on and talk about distribution, which I think is really interesting, especially in healthcare, right? Yeah. Third part is going to be about fundraising. We'll spend just a couple of minutes talking about any kind of fundraising advice you have for people in health tech. And the last part is going to be about operationalizing your business, any kind of efficiency hacks that you use to make sure that you hit all of your goals, your team hits all of your goals. So that's how we're going to carve it up. But right before we get started, for those of our listeners that might have missed the first episode, could you describe for us one more time in a few sentences, what is Commons Clinic and what problem are you guys trying to solve?
Yeah, so thanks again for having me. At Commons Clinic, we are building what I think can most simply be described as the One Medical, or insert your favorite, technology-enabled, brand-first clinic concept for musculoskeletal care. So spine, orthopedics, interventional pain management, physical therapy. If you have knee arthritis, low back pain, or anything in between, we are your one-stop shop for care.
Awesome. And folks, once again, if you didn't check out the first episode, you can learn more about Commons Clinic and how it works. Just feel free to find it on any of your major podcasting platforms. All right, so let's start off and talk a little bit about product, right? So in the previous episode, you shared a little bit about your journey to discovering that this problem exists, right? That this kind of musculoskeletal care involves multiple facets, multiple different touch points, and typically it's very hard to get it done in a way that really benefits the consumer. Could you talk to us a little bit more about the process of building conviction in that problem? So from the first time you understood this problem existed, how did you get to the point of saying that, hey, this problem is so big and it's so solvable that I should go and spend all of my time doing it? How did you get to that, 80, 90% conviction level that you needed to dive in?
Yeah, so, I really like to build products around inflection points. And what I mean by inflection points is like something has so foundationally changed in the world that it makes your product obvious, but also early. And so I think for me, it was on two things, right? One is the site of service arbitrage in surgical healthcare. This is maybe a little esoteric for your audience, but a total hip replacement, for example. My dad had double hip replacements in late 2018. And he had them in the surgery center. That care is about 40% cheaper than that same care delivered in a hospital-based environment. And when I learned that, I was like, well, why is that? It's the exact same thing. It's just in a different box, right? And it's really driven by this amazing technological progress in minimally invasive surgical care. And that was an aha moment for me. I was like, okay, well, how can I build a product that captures that arbitrage, right? And then on the other side, something very important happened to us all in 2020, right? COVID hit. What happened in the healthcare ecosystem is you had these big brands, these hospitals on the hill that we've trusted for our lives to deliver us healthcare that were put in a totally new position. They're filled with COVID patients, but they had to turn off elective surgeries. And, something strange happened. They also had to lay off a ton of people, unfortunately. And I'm sitting there and saying, hey, you're full of COVID patients, but you're hemorrhaging money in laying off staff. Why is that? And the reality is that elective surgeries, prop up the entire house of cards. And to me, it was the first time that I had seen the fragility of, the hospital-based ecosystem. And I thought, okay, I can go build a product that can go compete with an incumbent that's not delivering the same value they used to deliver to a consumer. And so that pain point, that opportunity is ultimately, where I think you build products around.
I think that's a really interesting insight. Let's unpack that a little bit. So when you said that, hey, getting the surgery done at a center that's outside of a hospital was 40% cheaper, now that's a huge margin. In a hospital, where's the money going? So for example, is it that the cost of delivering surgery there is actually much higher and the margins that they're getting as opposed to a different clinic are actually the same? Or is it, I think you touched on this briefly, is it that they're actually hiking up the price and the margins on these surgeries in order to cover for all of the other services in the hospital, some of which may even be making some kind of a loss?
Yeah. I mean, it's all of the above, right? Hospitals, nationwide run at like sub 5% margins in many cases. And that's because they have 60% fixed costs, like their property, plant, and equipment is just, massive infrastructure. And rightly so, right? Like they deliver a lot of services to the community, intensive care, certain service lines that don't make a great margin, right? And ultimately, elective surgeries, the high margin stuff subsidizes it, right? And, it creates a kind of network effect, right? Where you need to continue getting bigger, you need to continue charging more. And I think that it's caused a lot of the problems with why healthcare is so expensive in this country. And I think, we're, kind of in the business of saying, okay, we understand the value of hospitals. Like no one's arguing that they should go away. I'm arguing that they should reallocate resources and really focus on something different. I can deliver, musculoskeletal, surgical, and non-surgical care more efficiently outside of the hospital by taking away a lot of those, bad incentives and just heavy infrastructure problems.
Really interesting. I'm curious how much of this cost bloat that you see in hospitals is a result of, for example, administrative costs. There's one statistic that always stands out to me, and I might be off by a couple of percent give or take here, but it was something around 26% of all U.S. healthcare spend per year goes to administrative costs. And when you look at the total spend, it's somewhere around $4 trillion. So the U.S. is hemorrhaging somewhere around the order of $1 trillion into administrative spend. And then if you think about like, hey, where is all this going? Well, if you go into the hospital, nothing's automated, right? You go up to a doctor in the hospital, they have you fill out manual forms, they're calling to make appointments, they have scheduling issues, all of the above. So I'm curious, do you think a lot of the efficiency that, you're able to drive here by running a different set of clinics is actually by diminishing the administrative costs through technology?
So I would even just broaden it and say, on a macro level, technology is deflationary, right? When you apply technology to problems, it makes the system more efficient, right? And so healthcare has some massive bloat. You just very eloquently articulated the administrative problem, right? When we first started Commons, I went into one of our clinics and I sat with one of our surgery schedulers and I said, okay, show me how long and how difficult it is for you to go schedule this surgery with the hospital down the street. Took 23 minutes, and that included several faxes back and forth, and calling the scheduler at the hospital. And it's a disaster. Like, that should be an API call, right? 23 minutes over and over again all day long for thousands and thousands of patients is a ton of lost productivity that technology can solve. But technology, in my opinion, doesn't just mean automation. It also means, especially in the surgical world, shifting care paradigms, right? You couldn't do a total knee replacement in a surgery center and get paid by Medicare until 2017, 2018, right? We're talking about, a surgical innovation that is less than, a decade old, that has already, made it so care is migrating so fast out of hospitals and into a much lower, lower cost environment. That innovation, that technology, when harnessed, appropriately, can just make things so much more efficient holistically, right? And that's how we ultimately think about our opportunity to leverage technology to completely counter position the legacy infrastructure of hospitals.
Very cool. So what you're saying is that, yes, on the administrative front, but more broadly, I mean, correct me if I'm wrong, more broadly, technology drives efficiencies in every core competency of running healthcare.
Well, one of the things that I've learned in my journey in healthcare is to focus on big arbitrages, right? It's fantastic to get a 10% improvement on something because of technology, but I'd rather play a different game and get 50, 60, 75% improvement just based on these big structural advantages that either technology or some sort of technology-enabled solution can drive.
Interesting. That makes sense. All right, Nick, shifting a little bit over to distribution, let's talk a little bit more about how you acquire customers. If you had to articulate it, and for you, I guess there's different stakeholders that you need to acquire. On one hand, you have customers or patients, and on the other hand, you also have providers, right? You need to bring in both sides. So at a high level, could you describe what your acquisition strategy is here, and what are all the major channels that you leverage and actively think about?
Yeah, absolutely. So let me first by telling you what the worst way to build my business would be. The worst way to build my business would be to spend a bunch of money on a big, beautiful clinic, hire the most affordable surgeons I could possibly find, probably early career. It doesn't mean they're bad surgeons, it just means they are early, and spend a ton of money on Facebook and Google ads to try to get volume, right? That is this imperfectly executed. The way that we really think about things is we have three core growth funnels. The first is really we work with surgeons that we can bring under our platform that come to us with thriving books of business, thriving case volume, right? I can take that case volume and I can better monetize it, right, through our value-based business model. Two is omni-channel direct-to-consumer. We're ultimately playing a local market healthcare game. There isn't even enough inventory for me to just grow off of Facebook ads. This really means about having a kind of a multidisciplinary marketing approach, from PR to going to the Brentwood Farmers Market 20 weekends in a row, and talking to the community, all the way through having a really cemented digital presence to build that that groundswell and word of mouth. And then critically working closely with our health plan and employer customers to drive inorganic growth. So say, hey, can we tier benefits designed to make this more affordable for your beneficiaries? Or can we send them direct mail? Can we do all of these things to ultimately hack distribution? Everything that I am trying to accomplish with Commons is to avoid the cold start issue, right? I do not want to have empty clinics. I want to have liquidity on day one. And I think that's one of the things that my team really focuses on is go find the pools of patients where they're already flowing and try and capture that, right? Don't try to create demand out of thin air.
Interesting. I think all 3 points you mentioned are very unique, and I like how you're approaching it. I want to unpack the first point a little bit more, because I think for a lot of healthcare entrepreneurs that are thinking about starting some kind of solution where they have providers of their own, it can be very difficult just to imagine how are you going to get these providers, because, if you look at some of the best talent in medicine, they typically flock to these university affiliated hospitals, your Weill Cornells, your Columbias, or, your UCSFs, et cetera, right? So I'm curious, how do you go about making that sell to providers that, hey, come focus your time on my platform instead of with these major institutions? Is it financial incentivization, or, I guess what are the key factors here?
Yeah, so, I think we live in a healthcare landscape today, especially in major markets like you just espoused, New York City, San Francisco, LA, where the opportunities are, maintain independence, right? Go build a private practice. That's really difficult, right? Income is degrading as reimbursement trends, kind of play out. Overhead's going up. It costs more to pay your front desk staff than it did. Your lease costs more, and income's degrading. And staying competitive in an increasingly, connected healthcare ecosystem is tough. So we really target independent physicians primarily that are looking for a platform to join that can, provide them income stability, high upside, and then also participate in a new novel value-based reimbursement construct with health plans. Next to the economic incentives where we think we can, frankly, make physicians more money and give them more stability in their income, there's also the care model, right? Physicians get into being doctors because they want to deliver great care. And if we can give them the practice infrastructure to be able to deliver better outcomes for their patients and really the safety net for them to be successful, we found that to be an incredibly, compelling value prop. And then the third is just, having a better consumer experience, consumer brand, both so that they can deliver, the quality of experience to patients that they think their patients deserve, but also to help them grow, right? I think all of these are kind of durable competitive advantages. And, physicians are, no surprise, really smart. And I think they flock to quality, right? And, Commons is designed to be that quality.
Very cool. So when you're going to these physicians, surgeons, any kind of doctor, essentially, you're not going for these large institutions. Like, you're not going to a Mayo Clinic's doctor and saying, hey, do you want to hop onto our platform instead? You're going to independent clinicians and saying that, hey, you're already trying to run your practice independently. Why don't you come over here, and we're not only going to make you more money for your time, but we're also going to help you improve patients' lives more and improve a greater volume of patients' lives. Is that a fair way to sum it up?
Yeah, on day one, right? Like, I see the opportunity for Commons is any high quality musculoskeletal provider, whether they're a surgeon, whether they're a pain management specialist, whether they're a physical therapist, ultimately we can be a home. What I would maybe stress to your audience and the way that I think about things is, when I think about my TAM, or in our case, like total addressable physicians, right? I think about, like, what do we do first versus what do we do next? The most portable book of business, the easiest folks for us to bring into our platform are independents, right? They are their own islands. It's much easier for us to do a deal, to maintain revenue continuity, and to ultimately implement our playbook, right? It's a little bit more difficult to rip someone out of a Mayo Clinic and, make sure that their book of business thrives. And so I really think about segmenting our physicians and then running our go-to-market playbook off of those segments and expanding TAM over time, right? The best technology businesses, the best healthcare business, the best businesses, period, they start with a narrow distribution focus. They crush it, and then they expand their TAM, whether that's with a new product, a new distribution strategy, so on and so forth.
Very cool. That makes a lot of sense. So just how there's this notion of a beachhead audience, right? You have your beachhead providers in this case. And then over time, you can think about different segments and bring them in. That makes a lot of sense. I'm curious, in part one, or in episode one, you shared that you don't actually need a lot of surgeons on board to reach $1 billion in revenue or valuation. I forget which one was mentioned.
We're in the revenue business, not the valuation business.
Gotcha. Okay. For $1 billion in revenue, right? Could you walk us through just high level math here, how that works out?
Yeah. So let's take a typical surgeon, right? Let's say that they're doing, knee replacements or shoulder reconstructions or something. That physician today in private practice or whatever they are, they're billing for professional fees, basically what they do with their hands. That's typically 10 to 20% of all of the expenditure for that episode of care. a lot of money goes elsewhere. It goes to the hospital. It goes to physical therapy. It goes to all of this, this kind of assembly line of care, right? And the physician only captures a pretty small percentage of that overall economic value. What we do at Commons is we take on the risk and responsibility for that entire episode of care, and we get paid for it, right? So rather than getting paid, maybe $3,000-$4,000 for what the physician can do with their hands, we get paid $30,000 for that episode of care. And so when I think about it that way, I take my physician who maybe last year did, $2 million of revenue. And I think, okay, if I can flip your book of business over to a value-based contract, maybe that opportunity is $8 to $10 million top line, right? And so you start to do the math, right? Can a sports medicine physician or a total joint replacement specialist or a spinal fusion specialist, can they generate $4 million of revenue under our revenue model? Conservatively, the answer is yes, right? So how many of those do we need to go launch and build to $1 billion of revenue? We need 250. And so I ask myself the question, right? Like, how many markets do I need to be in to get to 250 physicians? And when you look at the data in a market like LA, you start to think like, oh shit, I can do it in one market, right? Healthcare is so vast and the opportunity is so big, right?
Right.
And so, so we're really, managing, such massive spends nationally. And so we're trying to capture that in a very efficient way.
That makes sense. And I think, so one statistic I remember reading a while back was if you take a look at the average physician in the US, a hospital typically earns $2 million of top line revenue for your average physician. So it makes sense how, with some additional optimizations, and obviously because, the people you're working with aren't just physicians, they're surgeons, which requires additional training and are typically more expensive, the top line is going to be greater than that number. So very cool. Given we're limited on time, let's move on to the third section here and talk just briefly about fundraising. So you've raised $11 million so far, split between last year and this year. I'm curious, for early stage health tech entrepreneurs that are just starting out pre-raise, do you have one unconventional fundraising tip that you might offer them? Not your traditional tell a story or, hey, do all your meetings in 2 weeks, but something that you found that's kind of interesting or clever that you'd love to share.
Set your price. So I think when if you've done the hard work of, hopefully before starting a company, developing relationships, having people that want to back you, having a network, and I would, recommend doing that for 2, 3, 4, 5 years before you start a company. Like, make sure that you are, that you're ready to hit the ground running, and then, and then go out and say, okay, you need a little bit of money to get started, price you're safe, and orient people around that price, right? I think the biggest mistake early stage entrepreneurs make is they go to angels and they say, and they're asked, do you have a price? And they're like, no, we're looking for a lead. We're looking for a lead. Anything under, $1 million, just price it yourself, right? When you start to get into 3, 4, 5 million bucks, yeah, maybe you want your lead seed investor to price it, and maybe there's some signaling value and whatever. But we've grown into this really decentralized fundraising environment, right? And, smaller check angels can be so immensely helpful for the future of your business. Open up a safe, price it fairly, right? And then go, just go do the hard work of, pitching people and getting money. But don't wait for anyone to give you permission. Just do it.
That makes sense. So what you're saying is, hey, don't wait for a lead investor to come and price your valuation cap, especially when you're as early as a safe. Instead, set it yourself and increment it in tranches as you move around your fundraising round. Is that correct?
Yeah. And everyone's situation is different, right? But I think if most people need $1 million to get started, right? That's how you go do it. Maybe you have a super capital, heavy business. Maybe you need to do it differently. So none of these heuristics are perfect. But I would just say, I think one of the biggest myths of early stage fundraising is that you need that validation from someone. No, what you really need is a great business, a great price, and folks that are willing to fund your business. And I think we live in an ecosystem where you can create your own, momentum and destiny.
Awesome. Very cool. I love that. So the last section that we have to talk about here is operationalizing your business. I'm curious, are there 1 to 2 top strategies or tactics that you use to make sure that your team is collectively hitting their goals? And I think this is going to be especially valuable coming from you because, your team isn't just software engineers, product people, marketing people, etc. It's also PTs, surgeons, everyone together, so multidisciplined. So I'm really curious what you have to say here.
Yeah. So I think, if I had to critique myself as a founder, I am probably not the strongest, hardcore operator. So my hack here is hire awesome people, right? And that's the easy, answer. But I think especially in healthcare or when you are building a product that's pretty vast, I think what I preach to my team is really focus on the stuff that makes your beer taste better, right? It's not the process, it's the ingredients, right? And so what makes us special to 20% of things like our brand, like our care model, like our consumer experience? And then where can we offload really important but kind of commodity things off to really great partners? So in healthcare, rule number 1, never build your own medical records technology, right?
Right.
Rule number 2, never run your own rev cycle, outsource it. Someone else can do it better than you, right? And so it's really about making focused investments in the thing that matters and narrowing the scope of what you need to be great at, right? I think is a key piece to making sure that you're, operationally and changing, addressing the things that just move the needle.
Got it. So focus on your core competency, hire really well in your core competency, and other things that may be important, find good partners to help you do it.
That was clearer than I said it. Yes, Akkshay.
Well, my job here is just to summarize what you're saying, right? So it's easier for me to do it. But okay, awesome. That's great. I love that. Just as we're wrapping up the episode here, I wanted to give you one more chance to plug anything you'd like. You guys raised recently. If you're hiring, if you want to plug that, if you're looking for customers, feel free.
Should I share my SoundCloud? Just shoot me a line on Twitter at @NSAubin, and would love to meet new people.
Awesome. Cool. There you heard it, folks. NS Aubin. Go follow him on Twitter. Go check out Commons Clinic as well. You can find them at commonsclinic.com. They're doing some really inspiring work. I think that's all the time we have today. Nick, thank you so much for sharing all these insights. I know we went a little bit over, but it was so worth it, both for me and hopefully our listeners as well.
Of course.
Thanks so much.
Thank you so much for having me.
All right, and that wraps up today's episode. We really hope you enjoyed it. Now, just before I let you go, I wanted to reiterate one thing. We're trying to build the best podcast out there for aspiring entrepreneurs, and to do that, we need your help. The best way you can help us is by joining our Discord community. The link is in the description below, and then leaving us feedback. Tell us how we did. Tell us how we can improve. We're eagerly waiting to hear from you. Other than that, show us some love and follow us on Twitter at The Breakouts Pod. And I think that's everything I have for you. We'll see you next time on The Breakouts.